Hello girls, welcome to e-learning of pharmacology and toxicology. We are going to study in today's lecture analgesic and antipyretic drugs. So first of all, we are discussing some definitions from the same. Analgesics. Analgesics are the drugs which are commonly known as painkillers, right? So these are used in pain killing activity. Analgesics are of having two types: narcotic analgesic and non-narcotic analgesics. Narcotic analgesics have been dealt in great detail in previous chapter, right? So in present chapter we are going to deal here only with non-narcotic analgesics. In addition to analgesic effect, these agents also have antipyretic, anti-inflammatory properties, therefore named as analgesic and antipyretic. These are also called as non-steroidal anti-inflammatory drugs, commonly pronounced it as NSAIDs. So we are going to start here. What is meant by pain? So pain is an unpleasant feeling such as a prick, tingle, sting, burn or any ache. Okay. So pain may be sharp or dull. Depending upon its intensity, it may be sharp or dull. It may come and go. It is not steady one, right? Or sometimes it becomes steady one, or it may be a constant, right? You may feel pain in one area of your body, such as your back, abdomen, again chest, pelvis, or you may feel pain all over the body, depending upon the organism or pain. Okay. Now we'll see what is meant by pyrexia. So pyrexia, also known as fever, is an increase in body temperature of an individual beyond the normal range. So first of all, I'll tell you what is the normal range of human body's temperature. So the normal range is 37 plus minus 2 degrees Celsius. Okay, that means ki 35 to 39 degrees Celsius plus 35 to 39 degrees Celsius is your body's normal temperature. This increase in temperature is usually considered dangerous, but it is a natural defensive mechanism of the body to fight against infections. How we'll see it? What is inflammation? Inflammation happens in everyone, whether you are aware of it or not, right? Some people are not aware about the inflammation which is going on in their body. Okay, your immune system creates inflammation to protect the body from infection, injury or diseases or diseased conditions. There are many things you wouldn't be able to heal from without inflammation, right? So inflammation is sometimes a good thing, right? It came under your defending mechanism of your body, right? So the 5 signs of inflammation include redness, that is rubor, RUBOR, rubber, swelling, this is second sign, swelling, third is heat, fourth pain, and last one loss of function. So there are another terminal word for the same. Redness we called it as rubber, swelling we called it as tumor, heat we called it as calor, pain we called as dollar, and loss of function. These are the 5 signs of inflammation. Now we'll see the types of inflammation. Acute inflammation and chronic inflammation. Depending upon the time period, it is categorized into 2 types, acute and chronic. So acute inflammation include tonsillitis, joint pain, bowel inflammation, headache and body pain, right? So tonsillitis, that means ki inflammation to your tonsil, right? Joint pains, okay? So the joints which are present in between your bones. Okay, so this is nothing but joint pain. Bowel inflammation, so your bowel irritation and inflammation. Headache, nothing but the pain which is occurred in your head region. Body pain, that means ki generalized pain. Okay, chronic inflammation. If the acute inflammation is not going treated, that time it will turn into a chronic stage. That means a greater time period occupying inflammation. arthritis, atherosclerosis, bowel disease, joint diseases and skin diseases are the type of chronic inflammation. Arthritis, you know, joint pains, or sandhivat we called it as, right. Atherosclerosis is deposition of fatty tissues, or there is a common signature symptom of atherosclerosis is what, narrowing of your blood vessels, right. So narrowing of your blood vessels will happen or occur due to presence of fatty tissues and all the matter or accumulation of tissues inside your blood vessel. It may become clogged or stuck, right. Bowel diseases, joint diseases and skin diseases. Next we'll see inflammation reactions. First of all we'll see acute inflammation. So allergic reactions, right. So like sneezing, weeping and all the things which are related to allergy is nothing like rashes, skin rashes and all, itching, these all include in allergic reactions, right. Chemical irritants, infections, okay, small infections, trauma or injury, burns, cuts, laceration cuts and wounds and frostbite, right. So all these came under acute inflammation. Okay, allergic reactions, you know what is meant by allergic reactions. So sneezing, coughing, whooping and skin reactions like redness, itching, all this came under allergic reactions, right. Chemical irritants, so any type of chemical material, when we are going in contact with any kind of chemical reagent, at that time we are feeling some kind of reactions, allergic reactions like redness, pain and all. This is nothing but the chemical irritants. Infections, you know, viral infections and all kind of infections. Trauma or injury, injury due to accidents or any kind of injury. Burns, you know, the burning skin and all. Laceration, cut, wounds and frostbite. Frostbite means what ki? Extreme cold. Okay, extreme, your body will be exposed to extreme cold situation. This is nothing but frostbite. Next we are going to see chronic inflammation, how it will going to chronic state. Okay, so cardiovascular diseases, that means ki diseases relating your heart. Okay, again neurological diseases, these are the diseases which are related to your nerves or neurological system. Again autoimmune diseases, you know what is meant by autoimmune disease. Body's immune system attacks healthy cells, right, its own healthy cells. The example include rheumatoid arthritis, again lupus and celiac diseases. Okay, again nextly rheumatoid arthritis, again cancer, okay, progression of unavoidable unconditional growth of the cancerous cells. Okay, lupus, this is the inflammatory disease caused when immune system attacks its own tissues. Okay, and it can affect joints, skin, kidneys, blood cells, brain, heart and lungs. Okay, next is fibromyalgia. Okay, what is meant by fibromyalgia? It is a widespread muscle pain and tenderness. Okay, it is related with your muscle pain and tenderness. It's accompanied by fatigue and altered sleep and memory and mood. Okay, next chronic fatigue syndrome. So it is related with your fatigue conditions. So acute inflammation usually occurs for a short time, right, yet often severe duration. It often resolves in 2 weeks or less. Okay, so time period is the main basic thing over here for classification of inflammation, because the acute term itself indicates that the time period is very short, right. Symptoms appear quickly such as heat, pain, redness, again swelling, loss of functions and all, right. So next is chronic inflammation. Chronic inflammation is a slower and generally less severe form of inflammation. unlike your acute inflammation. Acute inflammation is severe kind of inflammation, right? It is chronic inflammation typically lasts longer than 6 weeks, right? 6 weeks, that means here 1.5 month. It can occur when there is no injury, and it doesn't always end when the illness or injury is healed. Okay, it may remain in your body for longer period of time after surgery also. Okay, it may happen. Chronic inflammation has been linked to autoimmune disorders and even prolonged stress factors. Next, analgesics, antipyretics and anti-inflammatory agents. We are going to see one by one. First of all, we are going to see the analgesic definition. So, these are the drugs which relieve pain by blocking the pain impulses generation and transmission. Okay. So, analgesic are also called as pain killing drugs, okay, or agents. Antipyretic, these are the drugs which reduces the elevated body temperature, that is hyperpyrexia. Okay, if someone's body temperature is go on increasing, okay, that time the condition is called as hyperpyrexia. So, to relieve or to reduce the temperature of that patient who is suffering from hyperpyrexia, we are going to give them antipyretic agents to lower down their elevated body temperature, not normal body temperature but elevated body temperature. Next term is anti-inflammatory agents. So, these are the drugs used to treat inflammation, swelling and edema. Okay. So, we are going to see the classification of same: non-narcotic analgesic, antipyretic and anti-inflammatory agents. See, in this chapter we are only discussing with non-narcotic analgesic, because in earlier lecture we have already covered all the points which are related with narcotic analgesics. Okay. So, first of all we will see first category salicylates, second one para-aminophenol, third pyrazolones, and above next to that non-steroidal anti-inflammatory drugs. Okay. So, this is the classification system. Next is miscellaneous, again gold compounds, selective COX-2 inhibitors, again anti-gout drugs. Okay. So, first of all we will see salicylates from the same. Okay. So, example include aspirin, methyl salicylates, magnesium salicylic acid, sodium salicylates, salicylic acid and sulfasalazine. These are the examples which include in salicylate class. Okay. Next class is para-aminophenol. Very most commonly used example from this category is paracetamol and phenacetin. Okay. Next, pyrazolones. So, pyrazolone category include phenylbutazone, oxyphenbutazone and analgesic. Next is non-steroidal anti-inflammatory drugs. These are also commonly used medications nowadays. We commonly called it as NSAIDs. Okay, in that again the classification include, this classification is only NSAIDs classification. It include 6 classification systems or groups: indole derivatives, propionic acid derivatives, phenamides, again phenyl acetic acid derivatives, oxychem acid derivatives and sulfonamide, right. So, from that one first category we are going to see the example of same indole derivatives. Indole derivative include example indomethacin, sulindac and tolmedine. Next, propionic acid derivative. So, example include ibuprofen, ketoprofen, phenoprofen and naproxen. Also deoxybuprofen. Next is phenamides. Example include meclofenamide, mefenamic acid, flufenamic acid and tolfenamic acid. Next category include phenyl acetic acid derivatives, and the example which came under that category is are diclofenac, ketorolac, aceclofenac. Aceclofenac is very commonly used medication. Next category, oxychem acid derivatives. So example include piroxicam, tinoxicam, tioxicam, lornoxicam and meloxicam. Okay. And last category from NSAID class, sulfonamide, and example include nimesulide. Okay. So this is the example, the classification of only NSAIDs. Next class from your anti-inflammatory and antipyretic drug is miscellaneous category. Hydroxychloroquine, which is an anti-malarial agent, and penicillamine. Okay. Next category is gold compound, and the example include orothioglucose. Next is selective COX-2 inhibitors. In COX-2 inhibitors, selective COX-2 inhibitor, in that category, the example include celecoxib, rofecoxib, valdecoxib, paracoxib, firocoxib. Next category, next and last category from same is anti-gout drugs. Anti-gout drugs include the drugs allopurinol, colchicine and probenecid. See, in this classification system, they have given classification according to the chemical structure or chemical moiety, parent chemical moiety which is present, right? And according to their name, the drugs end name will be rememberized, right? So next is salicylates. We are going to start over here the salicylates. Okay, salicylates are most popular and effective analgesic agents. Acetyl salicylic acid, that is aspirin, is most widely used amongst the salicylates. Sorry, we are going to see the mechanism of action of it. So mechanism of action include three sets. Aspirin causes severe reduction of inflammation, analgesia, relief of pain, the prevention of clotting and the reduction of fever. So aspirin is also called as anti-clotting drug or anticoagulant, right? So these kind of drugs are also used in heart patients, right? Another one, next mechanism, aspirin suppresses the production of prostaglandins and thromboxane is due to inhibition of the cyclooxygenase, that means your COX enzyme. Okay, what the aspirin will do over here? Aspirin will going to suppress the production of this inflammatory agents, right? The agents or neurotransmitters or hormones which causes the inflammation in your human body. Okay, it will directly suppresses or stop the production of these agents, chemical agents. The agent include prostaglandin, thromboxane and all. Okay, and COX also. Cyclooxygenase is required for prostaglandin and thromboxane synthesis. Okay, so our drug or our aspirin will directly act on that cyclooxygenase, okay, that enzyme. So further pain and all the sensations which causes the inflammation in human will automatically be suppressed. Cell membrane phospholipids. So cell membrane phospholipids, again arachidonic acid. So it will again classified into two, COX-1, COX-1, COX-2, arachidonic acid and leukotrienes. Okay, so COX-1 physiologic, COX-2 inducible. Okay, so COX-1, prostaglandin PGI2, COX-2 prostaglandin PGE2, okay, or prostaglandin 2. So prostaglandin 2 is the thromboxane, stomach, intestine, kidney and platelets, mucosal protection, renal blood flow and hemostasis. So whenever the prostaglandin PGI2 will excrete or secrete in your body, what will happen over there? Mucosal protection, renal blood flow and hemostasis will be occurred. These are the pharmacological actions of the sick. Okay, so stomach, intestine, kidney and platelets, these are the affecting organisms over here, right? Now next is COX-2 inhibitors or COX-2 inducible agents. So it include organs, inflammatory sites, macrophages and synovitis. It is related with inflammation, pain and fever. Okay, so our drug will directly act on this cyclooxygenase 2 enzyme because these are associated with production of inflammation, pain and also the fever, right? Next, pharmacological actions of aspirin. So analgesic action, how it will act or analgesic action, salicylate block pain impulse generation and transmission to the pain receptor due to inhibition of prostaglandin synthesis, right? What will happen in after administration of aspirin? Aspirin will directly suppress the pain receptors or generation of pain impulse. So there will be no conduction, there will be no sending the message towards the brain regarding the pain reflex or stimuli. So you are not going to feel any kind of what we can say, pain, inflammation and any other symptom. What will happen? Pain, this is somatosensory cortex. Tissue injury, okay, tissue injury will happen or next provoke to inflammation. Mediator releases substance P, prostaglandin, serotonin, acetylcholine. These mediator will be released after inflammation, right? NIC receptor will will convey this message to your brain, right, from through the spinothalamic pathway. Okay, it will go to RAS, that is reticular activity system, and finally it will go to your thalamus region where the somatosensory cortex will feel pain sensation. This is the mechanism of pain. Anti-inflammatory action. Salicylates show anti-inflammatory action due to inhibition of enzyme cyclooxygenase, that is COX. Okay, what will happen over there? It will slow down the anti-inflammatory action due to inhibition of enzyme cyclooxygenase. Thus, inhibit the prostaglandin synthesis, which is very much it is associated with pain formation or inflammation. Prostaglandins are required for edema, pain, fever, itching, inflammation and swelling. So this is very important factor over here. Key pain, fever, itching, inflammation and swelling are the essential steps or essential signs which are came under the defensive mechanism of your immune system. Next, anti-rheumatic action. Salicylates reduces pain, swelling and fever in rheumatoid arthritis and rheumatic fever by 3 actions. We will see one by one. First of all, it will reduces the pain by inhibition of prostaglandin synthesis. See, all the drugs which are came under this category like anti-inflammatory category are just they are just inhibit the prostaglandin synthesis. Why prostaglandin? Because prostaglandins are associated with generation of pain, right, or sensation of pain. Okay, so inhibition of prostaglandin synthesis is the first. Another one, stimulation of adrenal medulla to secrete steroidal hormones. Okay, they'll stimulate your adrenal medulla. For what purpose? To secrete steroidal hormones to show anti-inflammatory action. Okay. Next, by raising the pain threshold value, they'll just increase the threshold value. Threshold, that means your limit, right? So pain feeling ability limit value they are going to increased. Okay. Next is antipyretic action. So salicylates reduces the elevated body temperature by sweating and inhibition of synthesis and release of prostaglandins E2 in hypothalamic temperature regulating center. So these are wherever you are taking an aspirin, sorry, so they are just release the prostaglandin E2 in hypothalamic temperature regulating center, so that your body temperature will be going on decreasing. Next is antiplatelet action. This is very much important action over here. See, salicylates reduces thromboxane A2 alpha synthesis. Hence, they inhibit platelet aggregation, thereby show antiplatelet action. Okay, this is the image for the same. And last one, uric acid excretion. Okay, so uric acid excretion, salicylate increases uric excretion of uric acid. Okay, hence used in acute gout diseases. Gastrointestinal action, so salicylates can cause acute gastritis and gastric ulceration due to damages of muscle layer that results in gastric hemorrhage. Okay, gastric bleedings. This is nothing but gastric bleedings. Again, bloody stool, iron deficiency anemia, etc. Okay. Again, the mucus production is take place because of prostaglandins, but salicylates inhibit prostaglandin synthesis and affect mucus production in stomach. So there will be decrease in mucus formation over there, right? Because of this, gastric acid attacks on gastric mucosa and results in ulcer formation, erosion and gastric bleedings also. Sometime what will happen, if we are taking this kind of medicines for longer period of time, it will go on eroding our inner mucosal layer. Okay, so there may be formation of ulcers, ulcerative colitis, erosion, gastric bleedings will be happen, right? So therapeutic uses of aspirin. So dose of the aspirin is 350 to 450 milligram. Okay, it include analgesia, antipyretic action, anti-inflammatory action, right? So analgesia, mild to moderate pain of musculoskeletal origin, headache, myalgia, neuralgia, toothache, dysmenorrhea and backache. Okay, in these all clinical manifestations you are using your aspirin for analgesic purpose. Next, antipyretic action, it lowers elevated body temperature, that is pyrexia, for symptomatic relief of pain, right? And third, anti-inflammatory activity, for this activity you are also using aspirin. So rheumatoid arthritis, osteoarthritis, bursitis and acute rheumatic fever, in these all clinical conditions or complications you will be use the aspirin drug. Okay, prophylaxis of thromboembolism, cerebral ischemia and venous emboli, also prevention of reinfarction in patients with previous history of acute myocardial infarction. Adverse drug reactions which are related with aspirin are salicism. So salicism, headache, confusion, tinnitus, deafness, sweating and palpitation, these all are the adverse drug reactions of aspirin. Again, hemorrhage, major gastric bleeding and GI tract hemorrhage. Again, hypersensitivity reactions, so skin rash, pruritus, bronchospasm, edema and shock. All these hypersensitive reactions are associated with your aspirin consumption. Ray's syndrome, this is very much important over here. For this question might be asked for your MCQ. Okay, so what is meant by Ray's syndrome? Aspirin in children with influenza or smallpox has been associated with Ray's syndrome. Okay, this the children which are invaded by the infections like smallpox and chickenpox, smallpox and influenza. Okay, a life-threatening condition marked by severe vomiting, lethargy, delirium, coma and death. Permanent brain damage may occur in survivors. So contraindication, where to not use this aspirin? First, in pregnant women, again if the severe bleeding is occurring. Why this aspirin is not used when the severe bleeding is happening, because your aspirin is having anticoagulant ability, right? So coagulation is necessary whenever there is a blood loss, right? So in severe bleeding we are not going to use this aspirin drug. Again, in allergic conditions, if someone is allergic to aspirin, that time we are not going to administer that drug. Again, impaired renal function, at that time we are not use this aspirin. Again, hemophilia, ulcer conditions, influenza and chicken pox, in all these conditions we are not using this aspirin drug. Okay, so aspirin should not be given in peptic ulcer. Why? See, aspirin is weakly acidic drug causing gastric acidosis, leading to gastric discomfort or distress, that is hyperacidity, nausea, vomiting and headache. Okay. So, if aspirin is taken in empty stomach, what will happen? Gastric acidosis causes damage to gastrointestinal tract, mucosa and erosion will be happening over there. Okay. That result in gastric ulcer formation, gastric bleeding and anemia. That is why we are not taking this drug in empty stomach and also in gastric acidotic conditions. So, this is all about your today's chapter.